Most women trying to fix hair loss are completely missing one tiny mineral, and without it, your hair simply cannot regrow. I'm talking about zinc, but here's the problem. Almost everyone takes the wrong type, the wrong dose, or takes it in a way that actually blocks absorption. If you want thicker hair, less shedding, and real regrowth, you need to get this exactly right. Hair follicles are some of the fastest growing cells in your entire body. That means they demand nutrients constantly, and zinc sits right at the center of that process. Zinc is required for DNA replication, cell division, and protein synthesis. Every single strand of hair is made from keratin, and zinc is critical for keratin production. When zinc is low, hair follicles weaken, growth slows, and hair enters the shedding phase much faster than it should. One of the earliest signs of zinc deficiency is increased hair fall, especially from the crown and hairline. You may also notice thinning eyebrows, brittle hair, or hair that simply won't grow past a certain length. What's interesting is that zinc deficiency doesn't always show up on basic blood tests because your body tightly regulates zinc in the blood. You can be functionally deficient and still get a normal lab result. Zinc also controls hormones that directly affect hair. Low zinc raises DHT sensitivity in hair follicles. DHT shrinks follicles over time, leading to thinner and shorter hair cycles. Zinc helps inhibit excess DHT activity at the follicle level, not by blocking hormones artificially, but by supporting the enzymes that keep things balanced. This is one reason zinc is so powerful for both men and women experiencing hair loss. Now, let's talk dosage, because this is where most people mess up. For hair regrowth, the effective daily amount of elemental zinc is typically between 25 to 50 milligrams per day. Going lower than 15 milligrams often does nothing for hair. Going higher than 50 milligrams for long periods can cause problems, especially copper deficiency. Zinc and copper compete for absorption, so balance matters. For most people dealing with active hair shedding, 30 mg per day is a sweet spot. If hair loss is severe, short-term use of 40 to 50 mg for 6 to 8 weeks can be helpful, followed by lower maintenance dose. This gives follicles the resources they need to recover without pushing the body out of balance. Just as important as dosage is the type of zinc. Zinc oxide is cheap and poorly absorbed. Zinc sulfate often causes stomach irritation. These forms are not ideal for hair regrowth. The best forms are zinc picolinate, zinc glycinate, and zinc citrate. Zinc picolinate is especially effective because it's highly bioavailable and easily absorbed by the intestinal lining. If you're serious about hair regrowth, this form matters. Timing also plays a role. Zinc should not be taken with calcium, iron, or magnesium because these minerals compete for absorption. Taking zinc on an empty stomach improves absorption, but if it causes nausea, take it with a small amount of protein, not dairy. Taking zinc before bed often works very well for hair and skin repair because that's when growth hormone activity is higher. Another mistake people make is ignoring copper entirely. If you take zinc longer than 2 months, you should include 1 to 2 milligrams of copper daily, either from food or a supplement. This prevents fatigue, weakness, and anemia-like symptoms that can actually worsen hair loss if copper drops too low. Zinc deficiency is extremely common, especially in people with digestive issues. High stress or insulin resistance. Stress depletes zinc rapidly. High sugar diets increase zinc loss through urine. Alcohol blocks zinc absorption. Even intense exercise can lower zinc levels over time. That means you could be doing many healthy things while quietly draining the very mineral your hair needs to grow. Food sources of zinc include oysters, red meat, pumpkin seeds, eggs, and shellfish. But here's the reality. Even with good food choices, many people still don't reach therapeutic levels needed for regrowth, especially if absorption is impaired. That's where supplementation becomes strategic, not optional. Zinc also works best when paired with other hair-supporting nutrients. Vitamin B6 helps zinc enter cells. Vitamin A helps regulate zinc metabolism. Adequate protein is essential because zinc activates enzymes that build keratin from amino acids. Without enough protein, zinc can't do its job properly. Hair regrowth doesn't happen overnight, but with proper zinc intake, many people notice reduced shedding within 4 to 6 weeks. New baby hairs often appear around the hairline and crown after 2 to 3 months. The key is consistency, correct dosage, and the right form. If you've tried oils, shampoos, and topical treatments without success, this could be the missing internal piece. Hair loss is rarely just a surface problem. When the body lacks zinc, the scalp pays the price. Get the dosage right, choose the right form, support absorption. That's how you give your hair follicles the signal to grow again. Most people think hair loss starts on the scalp, but in reality, it usually starts deep inside the body. One of the most overlooked root causes is zinc deficiency. What makes this so tricky is that zinc deficiency often develops silently. You don't wake up one day completely deficient. It happens slowly over months or even years until the hair follicles are no longer able to function the way they were designed. 2. Zinc is not just another mineral on a supplement label. It is involved in more than 300 enzymatic reactions in the body. When it comes to hair, zinc is absolutely essential because hair follicles are among the most rapidly dividing tissues you have. Any tissue that grows fast has extremely high nutritional demands. If zinc levels drop even slightly, the body starts rationing it for survival functions. And hair growth is one of the first things to be sacrificed. This is why hair thinning and excessive shedding are often early warning signs. Your body is saying, I don't have enough resources to maintain this non-essential tissue. From a survival standpoint, hair is not a priority. Your heart, brain, immune system, and blood sugar regulation will always come first. So when zinc is low, hair follicles slow down, shrink, and eventually shift into the resting phase much earlier than they should. One of zinc's most important roles in hair health is cell division. Each hair strand grows from a follicle that is constantly producing new cells. Zinc is required to copy DNA accurately during this process. Without enough zinc, the follicle cannot produce strong, healthy cells, and the hair shaft becomes thinner, weaker, and more prone to breaking and falling out. Over time, the follicle itself can miniaturize, producing finer and finer hair until growth stops altogether. Another critical role of zinc is protein synthesis. Hair is made primarily of keratin, a tough structural protein. Zinc activates enzymes that help assemble amino acids into keratin. If zinc is missing, even a high-protein diet won't fully translate into strong hair. This is why some people eat plenty of protein but still experience hair loss. The building blocks are there, but the machinery to assemble them is broken. Zinc deficiency also disrupts the hair growth cycle. Healthy hair cycles through growth, transition, and resting phases in a balanced rhythm. When zinc is low, more hairs prematurely enter the shedding phase. This leads to noticeable hair fall in the shower, on pillows, and when brushing. People often describe this as sudden hair loss, but in reality, the deficiency was building long before the shedding became visible. Hormones play another major role, and zinc is deeply involved here as well. Zinc helps regulate enzymes that control androgen activity at the hair follicle. When zinc is deficient, follicles become more sensitive to DHT, a hormone known to shrink hair follicles over time. This doesn't mean zinc blocks hormones unnaturally. Instead, it helps the body maintain balance. So follicles are not overstimulated by DHT signals. Without enough zinc, the hormonal environment around the follicle becomes hostile to growth. Inflammation is an or hidden connection. Zinc is a powerful anti-inflammatory mineral. It helps stabilize cell membranes and reduces oxidative stress. And when zinc levels are low, inflammation increases in the scalp tissue. This low-grade chronic inflammation interferes with nutrient delivery to follicles and damages the surrounding environment. Inflamed follicles don't grow strong hair. They either produce weak strands or shut down entirely. The immune system is also tightly linked to zinc. Zinc deficiency weakens immune regulation, which can trigger autoimmune type reactions in the scalp. In some people, this shows up as patchy hair loss or sudden shedding after stress or illness. Zinc helps regulate immune responses so the body doesn't mistakenly attack its own hair follicles. What makes zinc deficiency especially deceptive is that standard blood tests often fail to detect it. Blood zinc levels are tightly controlled because zinc in the blood is needed for critical functions. The body will pull zinc from tissues, including hair follicles, to keep blood levels normal. So you can be functionally deficient at the tissue level while lab results look fine. This is why many people are told everything is normal, yet their hair continues to thin. Modern diets are another major reason zinc deficiency is so widespread. Processed foods are extremely low in zinc. Even whole foods today contain less zinc than they did decades ago because of depleted soils. On top of that, High carbohydrate diets increase acre zinc loss through urine. Sugar and refined grains don't just fail to provide zinc, they actively deplete it. Digestive issues